You were dispatched to a skate park for a 20-year-old male with an obvious radial ulnar fracture to his right arm.
BSI is my scene safe.
Your scene is safe.
Mechanism of injury is radial ulnar fracture to the right arm. Is this my only patient?
Yes.
Call for additional resources, ALS ambulance.
They are on their way.
I'll consider C-spine. I'm going to have my partner hold manual C-spine till we rule out other injuries.
Okay. Good job.
GRC, what's my general impression of the patient?
Your general impression is a male that is screaming in pain and is self-splitting his right arm.
Okay. Checking the responsiveness, I'll ask him some questions. So, what's your name?
John.
Do you know where you are?
I'm at the skate park.
Do you know what time it is?
It's about 5 o'clock.
Do you know what's happening?
I think I broke my arm.
Okay, so patient is alert. And C, chief complaint is a broken radial ulnar fracture in his right arm. Are there any other chief complaints or major life threats?
He is not complaining of anything else besides his right arm pain.
ABCs. Assess an open airway. Patient was talking, so airway is open, but I'll take a look and insert adjunct as needed. B for breathing.
There is no adjunct needed.
Assess breathing, ensure adequate ventilation, equal rise and fall of the chest. Manage any injuries that obstructs breathing or ventilation, and then initiate oxygen therapy as needed. I'll give this patient 2 liters via nasal cannula just for comfort.
Good.
C, circulation. So I'll be checking quality of the pulse, which is wet.
Strong and regular.
And skin color, temperature, condition.
He's pink, warm, and dry.
And assess and control any major bleeding.
There's no bleeding.
And initiate shock management, so I'll keep him warm and elevate his feet. Determine patient priority level. I'll make him a high priority because we don't know the extent to his injury. And I'll need to do his GCS levels. So how was my patient? How are my patient's eyes? When did he open his eyes?
He's tracking you.
Okay, so 4. And then my patient seemed alert and verbal and aware.
He is talking appropriately.
So 5. And then how was his motor control?
He's moving properly as well.
Okay, so 6. So then GCS 15. Vitals. So I need his pulse, blood pressure, and respiration.
His blood pressure is 150 over 85. His pulse is 95, and his respirations are 22.
Okay. And then I'll take a sample. So signs and symptoms. Just be pain in the right arm.
Yeah.
Allergies.
He has none.
Medications.
He's on none.
Past pregnant history.
And he has no past medical history.
Last oral intake.
He had a Red Bull before this.
Events leading up to present.
He was skateboarding, drinking his Red Bull.
And then I'll do my secondary assessment. So for every body part that I go through, we're doing DCAT BTLS. And D is deformities and discolorations. C is contusions. A is abrasions. P is punctures and penetrations. B is burns. T is tenderness. L lacerations. S is swelling. So DCAT BTLS, the head. inspect and palpate the scalp, inspect eyes, ears, mouth, nose, and entire facial area.
Mm-hmm.
And then the neck, decap BTLS, check position of trachea, check jugular veins, and palpate cervical spine. Decap BTLS the chest, inspect, palpate, and auscultate the chest, and then lower extremities, decap BTLS, abdomen, not lower extremities, decap BTLS, abdomen. So inspect and palpate abdomen, inspect and palpate pelvis, verbalize inspection of genitalia, decap BTLS, lower extremities. We'll be checking GSM, CSM.
What's that stand for?
Sensory, motor, and circulation.
Yeah, you mixed them up.
So we'll
It's
be
okay.
checking, checking what toe I'm touching. I'll be checking either the pedal pulse or cap refill for circulation, and then doing gas pedal up and down. And then checking lower extremities, decap BTLS. Same thing, we'll check CSM, so pulse or cap refill. Which finger am I touching, and then have him squeeze both fingers, or squeeze 2 fingers. And then decap BTLS, thorax. So we'll turn the patient over while holding the manual C-spine. Inspect and palpate up from the cervical spine down past lumbar. Looking for any step-offs or deformities, and checking the entire back. And then after the back, assess and manage any secondary injuries, and then determine when and how I'm going to do reassessment. And he's a priority patient, so every 5 minutes we'll reassess his injuries, level of consciousness, and vital signs.
Good job.